Awesome. Let's go ahead and get started. Thank you all for joining. This is really exciting. This is kind of the second to our prior meeting that we had with Dr. Brink about a month and a half ago on ER Express. So really excited to kind of carry this, what we're dubbing as the masterclass series forward. A little bit of a personal introduction. I haven't had the chance to meet a lot of you. So my name is Connor Ware, joined NVA in back half of 2021. So still relatively new face at the organization. I'm part of the business operations team for the NVA Compassion First business, and I'm based out of LA. I'm so excited to be here and talk about Talkingvet. I've kind of been brought on and brought a little bit of a structure to this process. So expect some invites moving forward on different various topics. I really am kind of running it with the philosophy of by hospitals and for hospitals. So this is really kind of peer-to-peer conversation and meant to be much more conversational and really give that honest feedback from a peer-to-peer perspective. We'll have some time at the end of this presentation for Q&A. And if you have any questions while the presentation is going, please just use the chat. I'll do my best to moderate and kind of insert and interrupt Dr. Vancil as questions do come in. In addition to that, if there are follow-up questions that are best suited for the vendor itself and or any sort of demos that hospitals want from the Talkingvet vendor, just reach out via email at the end and we'll do our best to connect with Talkingvet folks. With that, I will hand the mic over to the incredible Dr. Vancil.
Well, thank you guys for joining us today. I think this will be, and certainly my goal is that this will be very informative and maybe start to walk you into a new area that you may have not thought about. And so, as you can see from the title, it's entitled "Breaking into Dictation for Veterinarians," and that's truly what the goal is today: is to kind of break down some barriers and really talk about some new technology that's out there, as well as try to troubleshoot some misconceptions that may come with dictation and how to use it in veterinary practice. Hold on for just a second. Okay, so a little bit about myself. We're gonna get started, but just tell you a little bit about who I am. So this is my family here on the screen, my son Cooper and my wife Heather. And Heather is a veterinary surgeon here at our practice. And Cooper is my 6-year-old who is a handful on a daily basis, and I love him to death. And then my other passions that I have in life are these two individuals right there, my motorcycle and my car. I'm a big car guy. That's a 67 Chevelle SS, which is one of my true loves. When I got into veterinary medicine, obviously Heather and I were a couple, but we did not have a family at the time. And a lot of today's, a lot of the driving force behind me traveling into this world of dictation was really driven by my life getting busier, becoming a dad, Heather and I becoming married, having hobbies and passions outside of work, and really trying to find that balance, looking for strategies to be more time efficient and really give me the opportunity to enjoy things outside of work. To tell you a little bit about the history of Nashville Veterinary Specialists and Animal Emergency, where we came from. So NVS, or Nashville Veterinary Specialists, started as a practice, especially practice with internal medicine, surgery, neurology, and emergency, and it started in the fall of 2010. I joined the practice in the spring or summer of 2012 and started the oncology service. And at that time, we were really growing pretty fast and really seeing a lot of interest in the area in specialty medicine. The practice started in about 7,000 square feet and quickly grew. And to date, here on site at our Nashville location, we are up to almost 27,000 square feet. We also have a second location, a sister location in Clarksville, Tennessee, about an hour away. And that practice is about 10,000 square feet. So in a really short period of time, from 2010 until 12 years later in 2022, you can see we grew at an exponential rate and also obviously added a lot more doctors and a lot more staff. We did about 2 years ago start the idea of expanding here in Nashville, and we created an outpatient services building, which is part of the 27,000 square feet that we talk about here in Nashville. And this is a building that became an expansion to have anything that was going to be just here for the day, such as oncology, cardiology, dermatology. It houses our administration. And when we were doing these projects, another thing started to come to light, and that is that I really enjoy getting into the world of architecture and really the design of these hospitals. Just as I was looking for strategies to be more efficient in my personal life and paperwork and the things we're going to really talk about today, I also look for opportunities to try to make our hospital have a different feel and really be more efficient and provide a better work environment. And so as all of these things came about and all of these things started compounding, I was finding myself getting busier and busier and trying to balance more and more things. This is where we developed our second location, our sister location. You'll see there in the picture, these are the owners of the practice and a couple of doctors there from Clarksville, including my wife, Heather. This was just an open building, and we now have a full functional specialty hospital there with internal medicine, surgery, and emergency. And this is where we were doing our outpatient services. There's me showing my skills and my vital skills of mopping. So obviously, when we kind of get to where we're really talking about today, you find yourself getting busier and busier, whether it's outside of work or inside of work, and the demands that come along with those workloads and those challenges. We really see pretty quick that we have to be highly efficient at what we do. When I first got out of practice, first got out of my residency and got into practice, when we start thinking about just record keeping, it was nothing like it was now, or nothing like it was back then. Now we are looking at clients who want a lot of information about the diseases we handle. They want good discharge instructions. The referring veterinarians are looking for, highly complete case summaries and information. We have obviously documentation now that we never saw before, documenting all the calls that we take in, talking to clients, talking to veterinarians on the phone. So it has just compounded over time, and it has led to what I would say a reduction in just the quality of patient care. Let's say we have a 30-minute recheck appointment. You may have 15 minutes of that or 50% of that time that you really have to spend on record keeping and some of the paperwork. Of that 30 minutes, now you've narrowed that down to a limited amount of time that you get to spend with the client and with the patient. It also leaves us with an everlasting amount of workload. We're taking home work, we're working long hours, that results in burnout, reduced productivity. And just quite simply, it's probably one of the major reasons that I would hypothesize, I guess I would say, that people decide that maybe this isn't the field that they want to be in. So I started to look for solutions, becoming a dad, becoming busier, doing all the things that I'm doing here at work. I started to look for solutions. And I think the first solution that everybody jumps to is, well, I just need more staff. I need more technicians. Maybe they can do data input for me. I need more support staff that will help me with my productivity. Well, the problem with that theory is that you have a large amount of time that then you have to bring those people on and train them. The onboarding process is not always easy. Finding the right people are not always easy. Then you have the idea that of retention. And that's something that I'm sure all of us are struggling with right now. You get somebody good, they're really good at their job, and then you lose them. When we looked at software or technology that maybe we could use across the hospital, this is also a pretty big hurdle, because now you've got to find something that meets everybody's needs, and it can be very consuming in terms of resources, both financially and time to put those into play. Something that I did find that worked well for me was I started using a lot of pre-written summaries. There's a lot of repetitive things that we use in our specialties, whether it's a lymphoma case for myself or a surgery case for the surgeons. There's a lot of the same information we're giving clients. So I developed a lot of biocodes and macros, and I think a lot of us do, and those are really good and can really help cut down on some of that repetitive typing and information you're putting out. But it was kind of clunky. I had to copy it, save it in a Word document, copy it, and paste it into my record, and that always become challenging. So you just get these big delays. Then if you are not able to keep up with your casework and your paperwork, then you get delays in getting the records out in a timely fashion. So I started to really try to struggle through, well, what could, what could be something that I could use to help have my information, my pre-written summaries, and get my records done in a timely fashion. And that's when the idea of dictation came up. Now, dictation's been around forever. I mean, everybody knows it. You can dictate on your cell phone. You've probably heard of Dragon. They've heard of all of these different dictation things. We know that the human guys use them, but there was a lot of skepticism from me. I mean, what's the cost of the equipment? Why are my friends not using it? Is it compatible in the veterinary world? Really, we think about the terminology we use and a lot of the things that are very specific for our field. And so those were concepts that kind of made me a little skeptical whether this would work or not. I'm not the most tech savvy person. So what's the challenge is going to be like using new software? Is it going to put a ton of errors in my medical records? And that's just going to make more time and more work for me. So all of those things that you may be thinking about in your mind right now are the same things that I was thinking as I entered into this idea of trying to use dictation. Also, you may have not noticed, but I have an accent. I'm from the South. And so I'm like, is it going to pick up any of the terminology and words? I mean, people don't understand me as it is sometimes. So, all of those things made me probably the best guinea pig to try this out, because I had the skepticism and I went into it thinking, all right, let's see how this works. So I found the company of Talkingvet, and Talkingvet was founded in 2012. It really drew my attention because it was the first dictation software that was made specifically for veterinarians. Veterinary vocabulary, veterinary terminology to be used in veterinary hospitals by veterinarians. And that alone was a big selling point because no one else out there at the time was really putting out that same terminology and that same vocabulary that we use in our field on a daily basis. The other thing that obviously drew our attention to it was it wasn't a huge entry cost and to step into this area, to step into this realm and try it. So we weren't looking at a ton of upstart to say, you know what, we're going to try to put this in play and just see how it works. Not like changing a hospital-wide software. So it was able to be something that I could put into play and attempt to use to see how it was going to work. One of the things that I found out really quick was it was super compatible with any software, really. I mean, I have actually used this, not that you're supposed to probably do this, but I've actually even used this in using it in Word, using it in Google. Anywhere I click my mouse and want to start to use my dictation device, I was able to see it, write the words that I speak. It's compatible with Macs, it's compatible with Windows. Now it's compatible with mobile devices. And so all of these things were really nice about this being a very user-friendly system that really did not require a lot of tech savviness to pick up on it. It was able to take my predefined templates and make shortcuts where I could drop them right into my record by just saying a word. If I say canine lymphoma, boom, it's going to drop that canine lymphoma template right in there. No copy, no pasting. So as we look at some of the benefits of Talkingvet and of this dictation system and what makes it somewhat different from others is that, one, you can dictate with this from anywhere at any time. I had a meeting that I was going to in Houston, and it was our Veterinary Cancer Society meeting. I did not get my records done. I was flying out on a Thursday afternoon to get there. I unplugged my mic, grabbed my laptop, went with me, got down to Houston, and sit in my hotel room on my laptop and finish my records. It's a cloud-based system, so it's able to be extremely mobile. Whether you want to set it home, you want to set outside, you want to set at your desk, you can use that and dictate from anywhere. It's a very, very efficient learning system. It's adapting speech recognition to your workflow, to your language, to my accent, to your accent. It can use that and learn over the first month or so that you're using it. to become more and more accurate. It also, if you sign on and you're using Talkingvet, the nice thing about it is that you're not having to go out and get new software when updates come in. They automatically update that in that cloud-based system. That product will always be up to date, and that product will always be current. You're not going to be behind. You're always getting that latest and greatest technology. And as I said earlier, the investment aspect of it, and we'll go over that towards the end because I'm sure you've had some questions about it. The upfront cost is very, very amenable to what we're doing. And certainly there's not this huge investment to step out and try this to see if it works for you. Do I think it works for everybody? No. But do I think that it has changed how I practice? Absolutely. And that's why I'm here talking about it today. So these are some of the microphones that can be used. I mean, you're obviously going to be dictating, so you're using your microphone as your main tool. The one that I use is just the standard Philips speech mic USB, which is not a wireless. It plugs into your USB port. They do make a Philips speech mic that is wireless. And now we can actually even dictate with smartphone applications. And so that is a new aspect to it, and certainly something that is making it even more user-friendly. So that is just giving you a little bit of some background on me, a little bit of a background on Talkingvet. But what you guys want to see is it in action. So I'm going to show you some examples of how this works. I have a couple pre-recorded examples of me using it. So I'm going to play those for you just to kind of give you a taste of it.
Okay, this next part, I'm going to show you just a couple of this is we can actually use. Okay, this is going to be an example of just a basic clinical record. We are using the EasyVet platform, as you will see. And as you can see in this record, there's really nothing here. So this would be patient comes in and we're going to just put the record together. So the first thing that we will do is simply click on the master problem, canine lymphoma. As you can see, add that in. We've got our diagnosis, and we run down here and we'll say, hey, we're going to do our clinical summary now for this patient. Rover was presented to the oncology for consultation and evaluation of multicentric lymphadenopathy, period. On presentation, this patient had multiple peripheral lymph nodes that were enlarged, ranging from 2 centimeters in diameter to 5 centimeters in diameter, period. I met with the owners and discussed the findings as well as the concern for canine lymphoma, period. At this time, I did recommend additional diagnostics, which included thoracic radiographs, an abdominal ultrasound, complete blood work, and a fine needle aspiration of a peripheral lymph node and submission for flow cytometry, period. For treatment, I am recommending a multi-drug CHOP chemotherapy course, period. This would include the chemotherapy drugs vincristine, cyclophosphamide, doxorubicin, and prednisone, period. The patient received his first treatment today with vincristine and will be sent home with oral cyclophosphamide to give in 1 week, period. The patient will be reevaluated in 2 weeks to monitor response to treatment, period. I will certainly keep you posted on this case and any additional treatment recommendations, period. I will also forward results of today's submitted flow cytometry when they become available, period. For more information regarding canine lymphoma, please see the attached information below, period. Next paragraph. Canine lymphoma. So as you can see in this record, as I close it, we were able to do a full case summary, as well as add a biocode or macro regarding details for canine lymphoma. We'll go down here to the follow-up. Recheck 2 weeks. And that allows me to put my full case summary in, the diagnosis, and my recheck, and we will skip the evaluation, which is basically going to be just adding my clinical exam, which is pretty straightforward. We have that set up in our easy bet as, I'll just do it real quick, as a template, which is just a tab through template that we can add. And obviously this is more of an easy bet application than a true Talkingvet application. But it's just pretty much tabbing and tabbing through the different parts of the exam. But as you can see from this example, we were able to do that full letter in extreme detail in about 2 minutes. So there's an example of just putting in a case summary as well as a biocode or macro for that disease. Okay, this next part, I'm going to show you just a couple other places where you can actually use the dictation system. I mean, ultimately, it's not limited to just your case summary. So if you remember on this last patient, we did some thoracic radiographs, and let's say you want to put your interpretation of that in. So we would click on it, it's got thoracic radiographs. Go down here to your outcome, and you would simply say, thoracic radiographs were found to be within normal limits. No evidence of pulmonary edema or pleural effusion was noted, period. The patient had a normal cardiac silhouette, period. We would have that put in. Now, this is an example of very unlikely for me to type pulmonary edema, pleural effusion, normal cardiac silhouette, just because of time's sake. And here you can actually increase the accuracy of your record by being able to verbally enter it. Communication is another great place to use it. If I go here, I can use it for any pathology results. I spoke to the owner and gave results of recent biopsy, period. Biopsy results indicated a hepatocellular carcinoma, period. The excision was complete. And at this time, we are not recommending any additional treatment, period.
Okay, so these were just a couple of examples of just how I use it on a daily basis, and I just want to say just for you guys, and that those were both one takes. That was not something where I took multiple times to show accuracy. Actually, both of those were just quickly yesterday. I sat down and just did one take on both of those. And that's how accurate it can be. I tried to select something to kind of give you an idea of how it picks up on drug names. As I went through chemotherapy drugs, these aren't not necessarily common drugs that we're using every day, but those are all within the vocabulary. We went through things like flow cytometry, that's in the vocabulary. We went through, using diseases, hepatocellular carcinoma there, that is in the vocabulary. So this is what makes this system different than your cell phone when you try to dictate something on your cell phone. It's not going to autocorrect it to something weird. I mean, it is really very accurate, and it gets more accurate as long as this product's been out there. I've only seen it get better, not worse. So just to kind of go over a few things there, I just wanted to kind of give you some examples, allow you to, to see what it looks like in action. So how does it work if you decided it's something you want to do? Well, this system basically is implemented per doctor. So you don't have to have all your doctors on it. If you just want to be the one person at your clinic that tries it, that's certainly totally fine. It's specific for you. It's going to learn your voice, your terminology. The way you want to use it is the way it will adapt. 30-day onboarding period where you're going to get support. They're going to walk you through it. We're going to give you some examples of that in a minute, but the cool thing is they're going to help you get better with it. The technician that will be teamed up with you, they're going to watch your system. They can actually see it from the backside and tell kind of how it's taking your language and the words it's using. If you use words that are not in the vocabulary, they can add that in. They do give you feedback throughout that 30-day period with report cards telling you here's some things that you can do to help you get better. Even changing the way you speak in medical records, it can be kind of giving you advice on that. One of the things I remember when I first started using this is I didn't give it enough credit. I didn't think it was as smart as it was. And so I actually would use these really short, choppy sentences. And I thought that was the way you do it. I always say like, the dog presented, period. The patient had cancer, period. Like I would use these really short sentences because I thought that would make it actually be more accurate. Well, it's actually not. It makes it be less accurate. It takes grammar. And if you look at if you look at the English language, there are the letter 2 or the number 2, excuse me, then there's TO, there's TOO, there's there, and there. And it's going to, when you say that, it's going to look at the verbiage of that whole sentence, the structure of that sentence to pick out which one of those needs to go in. Is it a number? Is it actually TO? So as you speak normal. You speak in long sentences just like you normally would, or just speak how you're comfortable, and it will correct to that, which was some of the advice I got on the front that really helped me be more accurate. So again, this just kind of gives you an idea of the accuracy service that they provide. Again, each new user is assigned a technician for the first 30 days, and it helps them go through and adapt your speech and get better. The technician will give you a score on the dictation of words per minute and accuracy. So you may get a score that says, hey, you were 90% accurate on that. And most of them are that high. Most of them are in the 90s. If there is work that is not reconciling well, if there's something that's not there, we'll look and see, or they'll look and see if they need to change the terminology or make some adjustments from the backside to help adapt to that. And again, help with the sentence modeling about how how that word structure should look as you're putting it in. So this kind of gives you an example from the backside on what it looks like. So again, this gives you an idea of what an administration console is. Basically, it has there recorded and stores the words that you use and then how it was written. And then if they need to correct anything, they can do that from that at that point. When we look at kind of report cards and what they look like, here's some examples where they looked at your custom vocabulary or substitutions that needed to be changed. And then also they give you some advice there, some tips, and you'll get that during the first 30 days to really help with your accuracy. And certainly just further information here. These are some tips that they'll email you talking about how to help you be more accurate. Talk louder, don't go up and down, or talk quieter. One question I get, and I think this is one of those things nobody likes to ask, but is it embarrassing talking around other people? Does it bother the people that are sitting around you when you're using your dictation? And to be honest, I was a little nervous about it at first. I think that everybody is, you're sitting over there talking and people are looking at you. But the reality of it is now, I don't even think about it. It's very similar to if you're talking on a phone. I mean, when you think about the people, you're sitting next to a doctor to the right or a doctor to the left, they're going to pick up their phone. They're going to have a 20-minute conversation with somebody about their patient that just came out of surgery or what's going on. And no one thinks about that. And that's how you look at this. I mean, you're really looking at it saying, it's just like me being on my phone, except I'm talking into my computer. And so that's how I look at it now. And I really don't have any issues at all. And the people around me, I've never had anyone really complain about it at all. I mean, again, I think I'm quieter when I'm on this than when I'm on the phone. So we're kind of coming down the last couple of slides. I just want to give you guys a little bit of an idea of the pricing structure. So this will kind of give you an idea. user per year has a subscription, and this is once you get started, once you're basically using it, the yearly subscription to use the platform, to use the cloud-based system is about $650. You can get a discount if you sign up for a 2 to 3 year. You can see there on the per month what it looks like per month. There's an onboarding fee, and this is your setup configuration. They sit with you for about an hour and help you train to how to use your mic, how to use these things. He's kind of walking you through the whole process. And honestly, it's pretty painless, but it kind of teaches you how to actually use it. It's about $3.99. That's a one-time fee. And then you have kind of your service and support, which is the 2 hours remote support. You have you get your email, you get your chats, and they can certainly help you. And that's for the location. And then there's some ideas of what the mics cost. They range anywhere from about $300 to $400. So why consider this, guys? Again, I think it's changed how I do, how I function on a daily basis. I do not think this is an overstatement at all that it saves 1 to 2 hours a day. I definitely do not. I think it does. I really, truly think that it saves 1 to 2 hours a day in record keeping at minimal. And if you think about that, if you're on a 4-day-a-week work week and you're saving 2 hours a day, you just saved yourself an 8-hour day. And that means when you're off, you're off. You can go have a hobby, spend time with your family. I think it does increase your ability to be more productive. You can focus more on the quality of medicine that you're putting out there. And then obviously what we're all looking for is a little better quality of life. And I think that it has done that for me. Like I said, I'm not going to sit here and tell you it's for everybody. I'm not going to sit here and tell you that it doesn't have mistakes or you don't have errors or funny words that end up in your letters, because they do. But I think that the accuracy is pretty high. So I am going to open it up to questions. I'll try to do what I can to answer any questions that you have. I hope that gives you a little bit of an idea of how to break into dictation and maybe knock some of those fears and misconceptions down a little bit for you.
If you do have any questions, you'll have to unmute yourself because I think almost everybody is muted.
So everybody's going to go use dictation, no questions. Okay.
I actually have a question. Ingrid Krebs here. I'm a surgeon in Nashville, North Carolina. So I've been using Talkingvet, and I really, really like it. I have the same. I kind of have the same thoughts as you do, as far as it's just streamlining. I'm also a bad typist, so that really helps actually. So the worse typist you are, the better this is going to be for you. The question I really have is sort of next level. How do you feel? Can it integrate by using shortcuts? Can you actually integrate it with the shortcuts or markup language that EasyVet can use to drop in fragments of things that then can be populated through tabbing through? So have you used it sort of to the next level, or are you just using it to dictate text, free type, and rather than dropping in kind of meta text?
Yeah, so it's a good question. Honestly, I haven't used a lot with the tabbing system and dropping that in. I actually did. So my wife is a veterinary surgeon as well, and actually created one for her. She uses this system as well, and I created one for her, and we kind of played around with it with just a standard cruciate ligament rupture TPLO patient, and it's actually pretty slick. I mean, it has all the pre-written verbiage, and then you tab down and it'll say left or right. You click left, you kind of tab down, it says without meniscal tear, with meniscal tear. She selects it, tabs down to the next one, and it puts her whole letter together. And so she used it for that, which was really, I thought, pretty slick. But I haven't actually created any for oncology. The capabilities are there, and again, that's probably the next level stuff. Right now I'm just using it for more free type, or free speaking, free typing scenario.
I will also say that you definitely have, especially when you start out, you have to have somebody else proofread your letters, because you say some funny shit when you dictate.
You do, and I think that's the big thing about it. I mean, I do think there is that probably is something that we've talked about here. If we got more people on it, could we justify a scenario where we had someone, not necessarily a true scribe, but our medical records people who will read through them and kind of just make edits along the way. I mean, we have medical records folks right now who kind of put the letters together, make them look good, and then send them out. They're not necessarily proofreading everything. So I do think there's still an opportunity for that. If you're really trying to take it from being 90% accurate to 100% accurate, there's still an opportunity for that. But I mean, I think even in a scribe system, only you can put your thoughts in. So you really still are looking to maybe adapt it to a system in that way where you still have an opportunity there to make it even more accurate.
And again, I've used the scribe system before. I like this much better because it's instant feedback and I can see what I'm saying pretty much immediately. I can proofread it right there and then myself and send it out versus a dictation into a machine that then somebody else transcribes. And sometimes you can get these real time scribe system, but then it gets pretty expensive too. And so I like this system quite a bit. I think it's really more of how can I utilize it kind of to the next level for me. But I'd encourage everybody to try it. I think it's a great system and I don't pay for it, so I don't care.
If there are any follow-up questions too, feel free to ping me via email and I can help facilitate that, whether that's with Dr. Vancil and or the vendor itself.
Well, thank you guys very much for your time. I really appreciate it. Hope this was informative for you.
Thank you all. Have a good day.
Thank you.
Thank you.